Welcome to another episode of Finest Design. This is Ali Ghanem, and in this episode I'm going to discuss with you the option of surgical interventions in the face. This is the red option out of the three. We talked about the green, we talked about the amber, and now we have the red. Historically, the red option was the only one available to combat the facial aging. We were not able to address the frowning line without cutting open the entire face and peeling the forehead from the skull and then destroying these muscles that create the frown. Luckily, science have advanced, and now with just simple injection to botulinum toxin, we are able to address a lot of the problems in the glabella without the need of drastic surgery. Similarly, fine lines around the mouth, for example, or around the face were necessary to eradicate by a procedure called dermabrasion, which is a surgical procedure that removes completely the superficial layers of the skin, mainly the epidermis and the superficial layer of the dermis, leading to sometimes scarring. Luckily, with some soft tissue augmentation, we are able to address these. However, in many occasions, we still need surgery. With the brow drooping, we need surgery to lift it. With bags under the eye, droopiness of the middle face and the lower neck, often we need surgical intervention to have correct restoration of our anatomical features. I have a great pleasure introducing Dr. Luiz Auersvald, one of the authorities on face and neck, deep plane and deep neck surgery, to discuss some of the extreme of facial aesthetic surgery. And here we are with Dr. Luiz Auersvald, my mentor and great facial aesthetic surgeon, talking about the red options in facial aesthetics. Welcome, Dr. Luiz.
Thank you. Thank you, Ali.
So we discussed in the previous episodes that with the facial aging, we have non-invasive and semi-invasive interventions that many times can solve the problem and bring about the facial appearance that our patients would like to have to enhance their psychological and their emotional well-being. However, sometimes these interventions are not adequate and we revert to surgery. When is that necessary?
Well, the face treatment is comprehensive, and sometimes all the previous treatments are not enough to treat what the patient now presents, because she or he has too much sagging of skin or volumes in the neck that enlarged and that now need a surgical approach.
Okay, so you are telling me that sometimes we really reach a point where only surgery is indicated. We hear about mini facelift, about extended plane facelift, deep plane facelift. What are the difference between these techniques?
You see that the face has different layers, starting with the bone, deep, and then muscle, and then the fat compartments, and then the skin. Sometimes the problem is just skin sagginess, and then sometimes you have problems with the sagging of the muscle itself. And sometimes you have large structures. So according to the level of sagging and volume created by the time and by aging, then you have to address with different surgeries. So mid-lift only for, say, middle third sagging, or a deep neck when the structures in the neck are enlarged.
So really, these techniques have to match the anatomical and the degree of severity that the patient presents with.
Yes, certainly, and that's why knowing the anatomy is so important in terms of safety. Safety is key for surgery, for any surgery, and here is not different.
So I have been in your operating room and I remember some of the excellent outcome you are able to achieve. And you are talking about safety. What kind of complication that can happen when we are doing deep neck or deep face surgery?
You see, the deeper you go, the closer you get to sensitive structures such as nerves and vessels. So when you're performing a surgery such as this one, First of all, you need to know where the nerves and the arteries and veins are, because you don't want to get close to them, or you want to know where they are so you can avoid their presence. Knowing the anatomy is the first step. So you have to go to the anatomy laboratory, know your anatomy, and then apply the adequate tactics, surgical techniques to achieve the good results.
Fantastic. So with the knowledge of anatomy and with all the technical competence of the surgeon, sometimes things go wrong and complications happen. How do you approach complication management in such patient?
First of all, you try to prevent. So there are tactics that we and other colleagues around the world have developed over the last decades, and these techniques and tactics make the surgery a lot more safe. But once you have a problem, obviously you have to deal with that problem. So for example, bleeding. If you have some bleeding, perhaps you're going to have accumulation of blood in a particular area, so you have to drain that. But fortunately, these complications are very, very uncommon.
And what is the glory of this surgical outcome? Why do we, as humans, go sometimes to these extremes in order to reverse the aging signs? What benefit deep neck and deep face surgery offer to our patients?
Yeah, you see sometimes, Ali, you have a patient in your office that you've tried many non-invasive procedures, conservative procedures, but patients sometimes with aging, they are unhappy with some features of their faces. In those situations, you really need to go to the surgical option, because when you do, for example, a redefinition of the neck contour, patients are really happy because they never thought they were able to achieve such a neck contour. And through surgery, you can deliver that. You can also deliver that somehow through non-invasive procedures, but in some instances, such as in you, if you allow me, you have a deep digastric muscle here, the submandibular gland. Only a liposuction or some non-invasive treatment wouldn't address those issues in your neck, for example. So you would start to be a good candidate for a deep neck surgery, because we could deliver a very pleasant neck contour through deep neck surgery, for example.
Maybe in the next series I will have had done. After thousands of deep neck and deep face surgeries that you have performed along with Dr. Luiz Auersvald, what do you offer as an advice to patients who want to undergo these surgeries if they are good candidates? What kind of preparation, mental and otherwise, they should have in mind?
It's a very good question, because the patient has to be prepared to take some time out. It's like planning a trip. I mean, you plan a trip, you're going to have a week, a couple of weeks that you're going to be out of town, your work, activities, you're going to have to stop. So here's the same. You're going to have to take some time out. You have to be prepared. You have to prepare your family to help you once you're at home. After you're discharged from the hospital, you go home, your family is going to receive you and will help you in the process.
I like that analogy of the journey on a vacation versus the journey post-recovery of surgery. Dr. Luiz, I'm very grateful you joined us on this. Thank you so much for that.
Thank you, Ali. Thank you.
So this was the red option, classical and advanced facial aesthetic surgery, and its role in reversing the signs of aging and getting us that closer to our finest design. I hope that you were not taken back by today's episode. It is the one associated with the highest impact in results, but also the highest risks. Aesthetic surgery of the face or the body must be taken in a very cool head and must have a cool-off period. We learned that doing a little bit on every aspect of the face or the body is far better than doing too much on one aspect. The harmony is very important to preserve here.
We may choose only a simple mini facelift that only addresses the skin, or we might choose to consider a deep plane one that addresses the entire thickness of the soft tissue of the face, from the epidermis all the way to under the muscle layer. That will have an impact on our downtime, but also on the longevity of the results. And we will shed more light on that in the next episode. I look forward to seeing you then, and for now, from me and from the team, goodbye.